Welcome to the Ohio Hospital Association's special recognition of the 2020 Leadership Awards. I'm Kurt Ludlow from Good Day Columbus on ABC6 and Fox 28. It's an honor to be a part of this year's celebration. OHA presents the Healthcare Leadership Awards to honor outstanding hospital executives and organizations whose leadership and achievements have enhanced and brought honor to Ohio hospitals. For those of you who may not know the Ohio Hospital Association's history, it was the first statewide hospital association in the country. Established in 1915, OHA has represented one of the state's most valuable and vital industries for more than 100 years. Guided by a dedicated team of healthcare and policy experts, clinicians, and business professionals, OHA strives to fulfill its mission every day to collaborate with 240 member hospitals and 14 health systems to ensure a healthy Ohio. Joining us now is OHA's President and CEO, Mike Abrams.
Hello, and welcome to our virtual celebration to honor OHA's Leadership Award honorees. Ohio's hospital community dates back to 1819. OHA is the country's first state-level hospital association and was founded by a group of 60 forward-thinking hospital leaders at the Hotel Breakers on August 25th, 1915. 105 years later, OHA is honored to recognize the forward-thinking, innovative leaders guiding our hospital community today through our annual awards program. Since our founding, OHA has served as the united voice of Ohio's hospital community, advocating for healthcare policies that support member hospitals and implementing patient safety and quality improvement initiatives. Over the years, we expanded our services to meet the evolving needs of members by offering workforce solutions, group unemployment, workers' compensation, and energy procurement programs, along with environmental stewardship and continuing education options. Across Ohio and the nation, our hospitals are the anchor institutions serving a vital role in the social and economic vitality of our communities. Hospitals provide employment for more than 5.7 million Americans, with tens of thousands of new healthcare jobs added regularly. These services require hospitals to spend billions on goods and services, generating more than $3 trillion of economic activity. In Ohio, hospitals employ more than 260,000 Ohioans and support another 280,000 jobs in businesses that serve these vast institutions. In fact, 5 of the largest 10 employers in Ohio are hospital systems. Ohio hospitals are cornerstones of the communities they serve, caring for the sick and injured and advancing wellness. Ohio hospitals in 2018 contributed $6.8 billion in net community benefit throughout the state, a 6% increase over 2017. Our member hospitals innovate and explore new strategies to improve the health outcomes in their communities by collaborating with other organizations and government agencies. At a time when hospitals are assuming more comprehensive roles in providing healthcare services and programming in our communities, strong leaders are essential. Great leadership demands strong qualities and strategic vision to ensure a hospital's success and vitality. Healthcare leaders need to have the temperament and intellect to overcome challenges, embrace opportunities, collaborate for improvement, and partner for success. Winston Churchill once said, "We make a living by what we get. We make a life by what we give." This year's honorees have shown tremendous leadership through years of service to advance healthcare outcomes and community wellness in Ohio. We are proud to celebrate the achievements of 3 outstanding leaders: Tom Zenty of University Hospitals, Sister Barbara Hahl of Mount Carmel, and Dennis Stone, a community and business leader from Union County and a member of Memorial Health's Board of Trustees. We congratulate these notable and admirable leaders for their achievements and thank them for their contributions to OHA and to Ohio's hospital community. Thank you for joining us and for celebrating the accomplishments of these remarkable leaders.
Our first Leadership Award presentation is the Dr. Eli Crew Community Service Excellence Award. This award recognizes individuals or organizations that are friends of hospitals and health systems and whose support of the healthcare industry reflects the public interest. Dr. Eli Crew was OHA's first president when the association was founded in 1915 at the Hotel Breakers at Cedar Point. He was superintendent of Miami Valley Hospital in Dayton. This year's honoree is Mr. Dennis Stone, vice chairperson of the Memorial Health Board of Trustees. Dennis joined the Memorial Health Board in December of 2003 and has an extensive 42-year career at the Ohio Auto Club in Worthington, from which he retired in 2013 as the organization's executive vice president. He has been a resident of Union County since 1977. Shortly after attending Lorain and Lakeland Community Colleges in Cleveland, Stone served in the U.S. Army from 1966 to 1968, including a tour in Vietnam. Through forward-thinking, fiercely independent leadership, Memorial Health has bucked national trends and established an impressive record of growth over the last 2 decades. Through his countless hours of service, Dennis guided key strategic decisions, placing the hospital in a position of strength, able to adapt to the changing healthcare needs of the community. These decisions have led to a combination of projects, partnerships, and added services to benefit the local patient community. As Dennis began his tenure as a trustee, Memorial Health was at a pivotal moment. Community hospitals were adapting to find ways to continue providing high-quality care on shrinking profit margins through aging facilities, compounded by the inability to fund capital projects. Dennis possessed strong financial acuity and a distinct leadership quality that benefited the board's deliberations and strategic planning for Memorial Health. Dennis, in collaboration with his fellow board trustees and the management team at Memorial Health, helped forge a new strategic direction by establishing the hospital's new 5 goals, including quality care, being an employer of choice, good medical staff relations, exemplary customer service, and strong financial viability. In 2004, the Miracle Life Center opened, followed by the opening of a new urgent care facility in 2006 and a sleep lab in 2007. Also, a new collaboration came to fruition in 2012, the Heart Partnership and the opening of Memorial's Heart and Surgical Pavilion, a partnership between Memorial Health and the Ohio State University Wexner Medical Center. That partnership focused on improving the heart and vascular health of the regional community by providing access to the quality and expertise of Ohio State's team at Memorial Hospital. The project also included construction of Union County's first cardiac cath lab. A decade later, the alliance between the two organizations has provided patients with direct access to specialists in cardiology and vascular medicine in a local integrated setting, boasting an overall increase of 71% in office visits since 2009. Recently, Memorial Health celebrated the grand opening of the inpatient and outpatient pavilions, a modern hospital for the next generations, preserving the healthcare future of the community. Under the leadership of a trailblazer like Dennis, Memorial Health has flourished through a well-orchestrated plan of business growth and strategic partnerships. Dennis will reign as the longest-serving board member of the Memorial Board of Trustees in its history. Since his induction to the Memorial Board, he has been a voracious learner of the business of healthcare, as well as the trends and developments of the industry overall. Dennis, for years, has attended governance conferences at both the Estes Park Institute and the Governance Institute with the sole purpose of gaining knowledge to better help chart the course of Memorial. Congratulations, Dennis Stone. Our next leadership award is OHA's James R. Castle Distinguished Service Award. This award is named after OHA's former president and CEO, who retired in 2011 after 23 years of service to the association. The Distinguished Service Award recognizes professionals whose professional attainments embody qualities of an outstanding leader or mentor for service to the healthcare community and who've made a significant impact in their hospitals, local community, and region of the state. This year's recipient is Sister Barbara Hahl of Mount Carmel. Sister Barbara is a servant leader with a tremendous contribution. Her nearly 40-year record of service at Mount Carmel Health System leaves a legacy that will stand for generations. Sister Barbara has spent a lifetime being a voice for those who have none and has taught countless others to do the same. Her passion for caring for those who are most vulnerable, As a caring, compassionate hospital leader with a long-standing record of service to patients, her colleagues and the communities of Central Ohio have seen firsthand her leadership impact. After spending 15 years as a teacher in Illinois and Indiana, Sister Barbara pivoted her career toward healthcare. She came to Mount Carmel in 1981 and worked her way up the ladder, serving in roles that include manager of medical records, assistant administrator for both clinical and non-clinical services, and interim chief operating officer at Mount Carmel East. Sister Barbara most recently served as the senior vice president of community health and well-being. In that role, she led Mount Carmel's nationally recognized community outreach programs, including those providing care to the homeless and other underserved populations, hundreds of thousands of patient encounters free of charge. Her overall responsibilities presiding over community health and well-being have been the spiritual health and wellness of the entire health system and the communities it serves. Under her leadership, the community health and well-being programs achieved national recognition. Sister Barbara oversaw more than $142.9 million in total uncompensated community benefits in fiscal year 2019, which provided free health services, outreach programs, and other initiatives that were invested in the health of the community's most vulnerable residents. The community-based programs she oversaw improved the lives and well-being of so many people, including expansion of the health system's street medicine and mobile coach programs, which serve homeless individuals and other underserved populations in Columbus free of charge. In 2018, the street medicine program provided medical, spiritual, and behavioral health services to 18,861 individuals who were new to America, homeless, uninsured, or underinsured, with barriers to obtaining health care services in Central Ohio. Distribution of 850 naloxone kits at 35 Mount Carmel Project Dawn events to teach community members how to recognize opiate overdoses and to administer life-saving interventions. Education, training, therapeutic advocacy, outreach, and therapeutic intervention at no cost to 30,989 individuals who were victims, survivors, and co-survivors of crime or trauma through Mount Carmel's Crime and Trauma Assistance Program. The low-income pharmacy at Mount Carmel assisted 13,566 qualified individuals last fiscal year in obtaining medications at little or no cost through various medication assistance programs. Mount Carmel's Welcome Home program provided 10,776 support calls and in-home visits from a registered nurse that are aimed to ease the transition from the hospital to home and reduce infant mortality. And finally, Healthy Start My Baby and Me program, which served 5,247 individuals, providing assistance for at-risk, pregnant Franklin County residents willing to receive ongoing intermittent home visits before and after delivery by a registered nurse. The evidence-based maternal child health and public health curriculum included well woman care, breastfeeding, infant safe sleep, and family reproductive life planning. Sister Barbara has received several awards for her leadership, including a Lifetime Achievement Award from Columbus CEO Magazine in 2013, Healthcare Heroes from Business First in 2009, and a Lifetime Achievement Award from the Mount Carmel Foundation in 2009. Under her leadership in 2019, Mount Carmel Street Medicine received Catholic Health Association's Achievement Citation recognition for an outstanding program or service that exemplifies the ministry's commitment to carry on its mission of compassion and healing. Congratulations, Sister Barbara Hahl. Tonight's final leadership award is OHA's Newkirk Award. This award was created in 1989 to recognize an individual's lifetime contribution to the healthcare in Ohio. Don Newkirk served as OHA's president and CEO for 18 years and was a member of OHA's management team for more than 30 years. This year's recipient is Thomas Zenty III, Chief Executive Officer of University Hospitals. Over his 40-year career with leadership roles at health systems in California, Arizona, New Jersey, and Connecticut, Tom has significantly contributed to the industry by shaping policy, establishing a culture of innovation at UH that has pioneered new treatment modalities, and train the next generation of providers, and by leveraging UH's influence as an economic powerhouse in the region to create jobs and encourage reinvestment back into the community. A component of the system strategy has been to move care as close to where patients live. Under his leadership, University Hospitals has grown from 3 hospitals to 18, with nearly 28,000 caregivers, and completed a campaign that raised more than $1.5 billion in philanthropic support. His tenure led a transformation of the institution that expanded services, supported caregiver recruitment and training, and endowed clinical and research programs for future generations. In addition to growth, Tom led University Hospital's expansion to new technologies, such as the opening in 2016 of a proton therapy center. The system also has a partnership with Case Western Reserve University School of Medicine, in which nearly 1,200 residents and fellows are trained at UH. The institutions also partner together in research. UH currently has 2,500 active clinical research trials. Tom has been the driving force behind numerous initiatives at UH that promoted a culture of innovation and transformation. For example, he supported establishing the Harrington Discovery Institute at University Hospitals, an international initiative that helps translate scientific discoveries into medicines that benefit society. The Institute programs address a range of disease areas and therapeutic needs, with an emphasis on unmet needs. Since the Institute's founding, more than 100 physicians and scientists have benefited from the support and resources provided, and the Institute formed an alliance with the University of Oxford to establish a global center for rare diseases, bringing hope to millions who suffer from conditions for which there are no treatment options. Launching UH Ventures to develop new business models that leverage and expand existing UH capabilities to pursue innovative opportunities that will drive definitive, sustainable, and scalable value to the way patients receive care. Creating new care models that improve healthcare value by helping patients stay well, get well, and manage acute conditions. Developing programs that enhance quality and value, earning UH a recognition as a center of excellence. In 2018, Walmart selected UH Cleveland Medical Center as a national COE to provide joint replacement surgery for its employees and families. Similarly, General Electric selected both UH Cleveland Medical Center and UH Conneaut Medical Center in 2016 as national COEs for joint replacement surgery. Zenty is a recipient of the Warren Bennis Award for Excellence in Leadership from the Global Institute of Leadership Development. He is a past trustee of the American Hospital Association, recognized by Modern Healthcare among the 100 most influential people in healthcare and in the Northeast Ohio Business Hall of Fame. He has received an honorary doctorate and has served on various visiting committees and faculties of universities within the U.S. and abroad. He has served or serves on the boards of publicly traded companies, not-for-profit community service organizations, and private equity corporations. Congratulations, Tom. We're so glad you could join us for this special recognition. Congratulations to this year's honorees. Applications for the 2021 Leadership Awards will open this fall, and all OHA member hospitals are encouraged to nominate a leader for this recognition. Thank you for being with us, and be well.